Hello, good evening. Just gonna wait for a few more people to join and then we will start our live tonight on blood flow restriction training. Hopefully everyone can hear me okay. Oh, hi Catherine. I'm just gonna wait for a few more people to join and we'll get started. I think we've all had a good start to the week. We've had a very busy start to the week here. And we've got a very busy week with lots and lots of rugby this week because it's all our sevens tournament starting. Hopefully we won't see many injuries from those as the ground is so muddy. We tend to see fewer injuries then. I'll just give everyone another minute or so. Cool, we will get started. If anyone else joins, they can catch up or watch the replay in a bit. So today we're going through blood flow restriction training, or BFR for short. So some of you might have heard of this, some of you might have used it, and some of you might not have done. So I just want to cover sort of what it is, when and how we use it, and also when not to use it for those circumstances where it's not always appropriate. So to give you a bit of background first as to why we might like to use it, from all injuries we can end up with some kind of atrophy. So atrophy is when we get muscular wastage, and that tends to happen after an injury for a few reasons. One, it can happen because that area is so painful that we think, I don't want to move that, I'm not going to move it because it's just too sore, and by not moving it, we're not using the muscles and therefore they waste away. That can happen acutely from the perspective that you've just had an injury, you've not used it for a few days, a few weeks, and then you start using it again, so it's not too bad, or sort of as a chronic injury, which is one that you've had for more than 12 weeks. If that's been happening for quite some time, then you could have quite severe muscle wastage that's been going on for a long time. With some research as well into different injuries, sometimes the weakness predisposes the injury, so you've got the weakness in the muscle, you then get injured because you've got the weakness, and then obviously you get even weaker initially whilst you're injured, unless of course you're having good rehab like with on your game, then you'll be getting stronger. But we know that sometimes it's obvious if someone's got a bit of muscle atrophy, so it might be that if it's their bicep, for example, you can see it's quite a bit smaller than the other side, or it might be that we've done tests with them and we can make an objective assessment and say, okay, this is this much percentage weaker than the other side. And muscle weakness is also sort of increasingly evident in non-injured healthy populations as well, such as older adults due to sarcopenia. So sarcopenia is sort of progressive muscle loss that we get with age, and that happens for a few different reasons. But this sort of describes like a loss of physical function due to the decrease in muscle mass and strength. And also with sarcopenia, we get sort of vascular function disruption, bone mineral density reduces as well, and that just sort of occurs with aging. But sarcopenia sort of appears to be underpinned by the reduced sensitivity of aging muscle to an anabolic stimuli. So it's like resistance training, older muscle does not respond as well. So one of the reasons why we might want to use BFR is we might get a different kind of response. So strength training for us as clinicians, for me as a physiotherapist and a sports therapist, is a completely indispensable sort of in clinic, something that we can use because it's just so good at getting people out of pain, increasing people's strength and getting them back to training and doing what they love. And most people that come to our clinic are active in some capacity, whether that is they really love walking, going for hikes, walking their dog, or on the other end of it, they play a really high level of football, rugby, they do marathon runs, that kind of thing. So we've got a whole spectrum here, but without having that ability to strength train, we're not going to get the improvements that we tend to get. So sort of in clinical MSK rehabilitation, which is what we do, musculoskeletal rehabilitation, so clinicians are faced with the task of turning all of the growing research that we have into this sort of effective clinical practice. So that's what we've tried to do with this blood flow restriction training, because we know things like, for example, our quadriceps strength, so the muscles at the front of your thigh, the stronger they are, it's been linked to sort of having less issues with knee arthritis. The weaker they are, the more likely you are to have more issues with knee arthritis. And also with reduced sort of joint space at the knee and narrowing, as well as sort of feeling more pain from arthritis. So, and heavy load resistance training as well has really been advocated as we get older to help offset that sarcopenia that we were talking about earlier, and to help improve muscle strength, muscle mass, and help with strength gaining. So they're sort of the areas that we might maybe be using this blood flow restriction in, but particularly if we're thinking post-immobilization. So if someone's had an ankle fracture or they've fractured their wrist, you're going to spend a bit of time in a cast, and that is perfect time to atrophy, so to lose that muscle. So blood flow restriction training is good to be using after them, and we'll go into why in a bit as well, because it's absolutely essential that we regain the strength lost as a result of the muscle disuse. So that sort of gives you a bit of context as to why strength training is so important and why we want to elicit that on your sort of rehab journey as quickly as possible. So when we're thinking about sort of when and how we use blood flow restriction training, historically, heavy exercise loads of approximately 70% of an individual's 1 repetition max have been deemed sort of necessary to elicit the muscle strength gain changes and the hypertrophy changes that we want. So hypertrophy is enlargement of the muscles when we're talking about it in a muscular context. If you want to know more information about hypertrophy, just put a comment in the chat, and I will tag you in Nat's live that he did a little while on this, and he did a whole live on sort of why hypertrophy is so important for rehabilitation. But it is very important for rehabilitation. It's all we need to know for the context of this live. But recent research has demonstrated that low load training to failure, so doing things with a lighter weight but working, sort of doing more repetitions till you get to that point of failure, can stimulate similar muscle hypertrophy when we're sort of looking at people training over like a 6 to 8 week period. And you might have remember when we went into that first lockdown 2 years ago, makes you shudder a little bit. The amount of people that were saying, don't worry if you don't have weights at home, like just grab anything and just do it to failure, you'll still get a good response. You know, that to a certain extent this is true, although I got incredibly bored with that after not very long of trying. But it's also not as effective in some ways. So one of the studies that we sort of looked at looking at heavy versus slow loads when we're moving them, so sort of low loads, even heavy loads versus low loads, did find that strength adaptations were maximised in those that did lift heavy loads, and sort of cross-sectional area. So when we're looking at the comparison in size of the musculature, shows that those that did heavier loads had a bit better than those that did lower loads. But sort of, and this is when they were sort of looking at blood flow restriction training. But nevertheless, from a sort of clinical musculoskeletal rehabilitation perspective, training to muscular failure may provide one strategy for us to maximise hypertrophy. So that means that, you know, with some of my patients, if you've got a really injured quadricep muscle, I'm not going to work you on a really heavy weight because you're just going to get re-injured. That would not be sensible of me. However, I can work you at a much lighter weight to failure without injuring you further, and obviously it's going to be helpful for your rehabilitation. So it's just thinking about those different situations. So we sort of want to make sure that we're maximising that hypertrophy when training, and using low lows in situations when using high lows just isn't feasible. So when we're thinking about when it wouldn't be feasible to use a heavy weight after an injury, a heavy weight would be, for an example, after an injury. So or it might be equipment available. We've got some patients that just don't want to go to the gym, they just don't like it, it's just not for them, they don't have the time, funds, whatever it is. So instead, we do blood flow restriction stuff with them. We say, right, just need to buy these on Amazon, you know, they're £10, you can do this at home, and we'll give you some stuff to do. And also we might maybe want to reduce pressure on their joints depending on what injury they've got. So again, blood flow restriction can be good. Help with that if they've got a lot of pain. Like I said before, I'm not going to load them heavy, so I can load them lighter. I can use blood flow restriction, I can elicit similar changes, and that's also thinking about the competency of your patient at lifting. So some people are going to be more competent at lifting weights because they do it all the time, they're practiced at it, whereas other people aren't so much. So we're trying to sort of pick the patients that it's most sensible for. And when we're sort of thinking about how blood flow restriction works from a sort of mechanistic standpoint, it's hypothesized that an ischemic and a hypoxic muscular environment is generated through the blood flow restriction training. So ischemic means without blood, hypoxic means without oxygen. So with the blood flow restriction training, because we're essentially putting a tourniquet on someone, so if it was on my arm and I was trying to get biceps, for example, I'd put it over here. What I'm doing then is I'm stopping that blood flow down, and with blood comes oxygen because our oxygen travels in our blood. So we're then stopping that muscle in that area getting the blood flow and the oxygen that they need. Obviously temporarily, this isn't something we're doing with patients for a really long period of time. But having that hypoxia and that ischemia at the same time has been shown to cause really high levels of metabolic stress alongside mechanical tension as well. So with blood flow restriction training, if we're using them sort of in tandem with exercise, we can get really good results. So because both metabolic stress and mechanical tension have been described as the primary factors for hypertrophy, sort of when we're trying to look to build that muscle. And it's going to theorise that to activate other mechanisms for the introduction of muscle growth, these are the things that we need to be able to do that. So blood flow restriction can really help us with that. And one of the things that I looked at before doing this live was a meta-analysis. So if you don't know what a meta-analysis is, it's when we get loads of different studies and sort of a group of people look at all of these studies to kind of come up with one kind of statement or sort of conclusion that they can draw from looking at all of the available research. So looking at this meta-analysis, we can see that compared with low load training with blood flow resistance, so if I'm lifting really light loads and just doing my bicep curls with or without my blood flow resistance band, we can see that training is more effective and tolerable and sort of very good in the blood flow restrictive group. So it shows that it's very much good for our sort of rehabilitation settings. And there is need for further research in blood flow restriction because we're sort of developing an individualised approach with our patients, and there's been not loads of research sort of on tendons and OA and sarcopenia and how it affects those, but we can give it a go and just see. And what's really great about blood flow resistance is that we only use about 30% of the load that we would use for hypertrophy. So if the maximum, we'll use it, this is an example for easy maths, if the maximum I can lift with my bicep is 10 kilos, I'm like, oh yeah, can only do one bicep curl for 10 kilos and I've got a biceps injury. In order to get good muscle response, I should be working at 70% of my max strength, so I should be working at around 7 kilos, but I'm injured, so that is just a bit too much for me, it's a bit too painful, I don't have a 7 kilo weight at home. But if I put a blood flow restriction band on and I hold a 3 kilo weight and I just work till failure, I'm going to get very similar results than if I had a 7 kilo weight with no blood flow restriction, but I'm not going to have these negative issues to do with pain and with strength that I just don't have at that point because I'm injured. But there has been some really interesting studies as well that we were looking at on Achilles and patella tendons, and they have shown really good improvements with blood flow restriction training, in some cases superior results to heavy slow resistance, which is what we typically use with tendon injuries. We use lots of eccentric exercises, which is where we are lengthening the muscle under tension. So for example, with my biceps, an eccentric movement would be me dropping my arm down because my bicep is contracting, but it's also stretching at the same time. So that's something that we use a lot for tendon injuries. And we also use heavy slow resistance. That's where we're going heavier with our weights, but we're moving more slowly to elicit changes in the tendons. And typically we have to be working at about 70% upwards for this. But this study showed that actually we can get really good results with working with lower loads, but using the blood flow restriction. But what is interesting about that study is it wasn't done on those that had injured tendons, it was done on healthy tendons. So, it's interesting to see that we can get tendon changes, but it would be really good to see a study on people that actually have tendon injuries. But in the clinic recently, we have been using this with people that have tendon injuries, and we have found that it's decreased their pain and it's managed to get them really good results so far. So we're just giving it a go and seeing what happens. And with this heavy slow resistance model that we like to use for tendons or the eccentric training, sometimes people's tendons are just too sore to be able to do that. We just can't get them lifting the loads that we need them to lift to elicit those changes because they're in too much pain. So using something like blood flow restriction, where we say, fine, we're not lifting heavy weights, we're lifting nice and light, but we're putting a blood flow a band on you to see how it goes, and we can go from there. So it's a really interesting thing that we can do with people. And if we're looking at sort of individuals with tendinopathies, rehabilitation, like we were saying, is where it's focused on that heavy, slow resistance. They were sort of using on that study 40% or less of their 1 rep max, and it was sort of shown to be effective. What I think is important to say with blood flow restriction training is that it's a really good therapy for sort of higher intensity training for those that are temporarily compromised. So, you're temporarily injured by either pain, or it's post-surgery, or you've been immobilized for a period of time. But I think it's good to say that this is something that's going to then lead you on to being able to do those heavier weights, because we have found that we do get better results from the heavy lifting overall, but it's just not going to be appropriate for some people at certain times. So it's more of like a stepping stone. It's sort of in between like having a weight that's too light and not being able to do the heavier one, and finding that middle ground where we think, okay, we can push you a bit more by adding the blood flow resistance in as well. So I think it's something that's really interesting. I think it's going to be really interesting to see all of the other research that comes out about it, because there's more and more stuff going on all the time. So we're constantly learning, and we're constantly learning as clinicians as well, and trying to keep ourselves up to date on what is relevant and what isn't. So moving on to when not to use it. If you have any ideas of when you think it might not be appropriate to use it, then feel free to pop it in the chat and we can discuss it as well. But sort of all patients, we have to kind of risk assess and decide, are you appropriate for this, are you not, and what are the contraindications to it. So the sort of possible sort of adverse reactions, or sort of people that might have adverse reactions, are those that have poor circulatory systems. So if we know someone's circulation isn't good, if they've maybe got something like Raynaud's, that are maybe already on some kind of drugs that help with their circulation or on their blood flow, and that kind of thing, they're on blood pressure tablets, any issues like that, or if we can already see that they've got fluid in their ankles, we're probably not going to then add on a blood flow restriction cuff to make that far worse in that area. Those that are obese as well, we do have to consider whether it's a safe option for them. Those that have diabetes, arterial calcification, sickle cell as well, and severe hypertension, so sort of very high blood pressure, or renal compromises as well. So that's kind of the situations in which we probably wouldn't use it. And some other things that we think of is like, have they previously had a deep vein thrombosis? Have they previously had any like peripheral vascular issues? So peripheral vascular issues is any issues sort of in like fingers or in their toes, to do with the blood supply to them. We obviously don't want to be then like cutting it off a little bit. So and any kind of cancers and stuff. So there's lots of different reasons we wouldn't use it, but generally it's pretty safe to use for most people. And the way it would look clinically was, say for example we were going back to my biceps example, I'd put the cuff on, I'd kind of do it as tight as I could manage around here. Be doing my bicep curls at around 30-40% of my weight, so 3-4 kilos, whatever I was able to lift, and I'd be trying to rep it out. So initially, if you give this a go at home, you'll find that the first 3 repetitions you think, this feels okay, this is manageable, and it really catches up with you, and then it's that, it just feels heavy and it feels really tight. So I'd be doing as many as I can. I'd then take the blood flow resistance cuff off, or the tourniquet off, and I would rest the next minute or so, anywhere from sort of 1 to 3 minutes, and I'd put it back on and I'd repeat the same thing again and do it sort of 2 or 3 times. So if you're going to give it a go, obviously seek medical advice as to whether it's safe for you to do so for your particular injury, but you may find that it's really helpful if you've got a tendon injury, if you've got a muscle injury. They're the main ones that we're going to be using it for. And you'll find as well it's not appropriate for every body part. If you've got a hip injury, it's probably not something that's going to be great, because we can't really cut off the blood supply there by putting something around your tummy. But if you've got any kind of calf, Achilles, quad, hamstring, upper limb kind of issue, then it could be quite helpful. And if you check out our Instagram page, which is @onyourgame_, I did just put up some exercises today that you can use for upper limb injuries. So if you've got any kind of bicep triceps, sort of lateral epicondylitis, medial epicondylitis, or golfers and tennis elbows. There's a few things on there to try. And then I'm going to be putting up some lower body stuff as well that you can have a look at, so make sure you get over to our Instagram page. So before we finish up, does anyone have any questions on what I've just gone through? Cool. I don't think we've got any questions, but if you think of any after, just put it in the comments, drop me a message. And if you have an injury and you want to know if this kind of training will help assist you, then you can comment on here or send us a message and we'll let you know. Jolene's asked where you can get the bands. You can literally just get them on Amazon. Jolene works at the same gym that we work at, and actually you can find them right outside our room if you want to use them. We've got lots of different sizes, so that's the other thing when you're looking to buy them. If you're doing it on the legs, you might want to get the larger ones. If you're doing it on someone's arms, you might want to get the smaller ones. But if you're wanting to give it a go and try before you buy, Joe, then come upstairs and you can grab some from opposite my work door. They're all sitting out there. But they're really easy to get hold of and they're quite cheap. I think we got sort of like a big packet of multiple sizes for about £24 on Amazon. But yeah, any other questions, let me know. Fab. Thanks, guys. Have a lovely evening.